If you like watching psychology content, subscribe to Psychology in Minutes. Have you ever replayed a simple conversation in your head 100 times, wondering if you said something wrong? Or felt your heart race before opening an email, fearing bad news? Maybe you've stayed awake at night imagining worst-case scenarios that never actually happened. If this sounds familiar, you're not alone, and you might be experiencing anxiety. Anxiety is a natural human response to stress, designed to keep us safe. But when worry becomes constant, overwhelming, and irrational, it may develop into an anxiety disorder. These disorders are among the most common mental health conditions in the world, affecting millions of people regardless of age, culture, or background. Anxiety disorders include generalized anxiety disorder, panic disorder, social anxiety disorder, specific phobias, and separation anxiety disorder. While they differ in triggers, they share a common feature: excessive fear or worry that interferes with daily life. People with generalized anxiety disorder often experience persistent and uncontrollable worry about everyday situations such as health, finances, relationships, or work. Panic disorder involves sudden and intense panic attacks characterized by chest pain, dizziness, breathlessness, and a feeling of losing control. Social anxiety disorder causes overwhelming fear of judgment or embarrassment in social situations. Phobias involve intense fear of specific objects or situations, such as heights or flying. Common symptoms include constant overthinking, restlessness, irritability, difficulty concentrating, muscle tension, fatigue, and sleep disturbances. You may feel perpetually on edge, as though something bad is about to happen. Physical symptoms can include sweating, trembling, nausea, a racing heartbeat, or shortness of breath. According to DSM-5 criteria, anxiety disorders involve excessive fear or worry that persists for months, is difficult to control, and significantly interferes with daily functioning. The distress must be severe enough to impact personal, social, or professional life. Now I know you want to know about the burning question: can anxiety ever truly go away? But before we answer that, let's discuss treatment options. There are several effective ways to manage anxiety. Therapy, particularly cognitive behavioral therapy, helps individuals identify negative thought patterns and replace them with healthier perspectives. Exposure therapy is especially effective for phobias and panic disorders. Medications such as selective serotonin reuptake inhibitors may be prescribed by psychiatrists to regulate brain chemistry. Lifestyle changes also play a vital role. Regular exercise reduces stress hormones and releases endorphins. A balanced diet rich in omega-3 fatty acids supports brain health. Limiting caffeine and sugar can prevent anxiety spikes. Gut health, supported by probiotics and fiber-rich foods, is increasingly linked to emotional well-being. Mindfulness, meditation, deep breathing exercises, and journaling can help calm the nervous system. These are just options. You should always consider a professional. For therapy, consult a certified clinical psychologist. For medication, consult a psychiatrist. Now, the answer to the burning question: can anxiety ever truly go away? For many people, anxiety can be effectively managed and significantly reduced. While occasional anxiety is a normal part of life, proper treatment and coping strategies allow individuals to lead calm, fulfilling lives. Support from loved ones can make a profound difference. Instead of saying, "just relax," try saying, "I'm here for you." Offer to accompany them to appointments or help them prepare for stressful situations like interviews or presentations. If someone is experiencing a panic attack, encourage slow breathing and reassure them that they are safe. Even sending a simple message like, "I'm thinking of you," can provide comfort. Anxiety does not define a person. It is simply a condition that can be managed with understanding and care. Healing begins with awareness, compassion, and support. Subscribe to Psychology in Minutes for more.